For the high fidelity simulation, the students would come in, they would check in, and we have a check-in space, and they could sit there and wait until the instructor is ready for them. Then in the high fidelity simulation area, we have a setup where faculty can present the scenario and prepare the students to be able to implement what they need to do. Then they break up and go into the simulation room, run the scenario, and then do a debriefing. And debriefing, of course, is also a really critical piece of their learning. They could either do it in the patient space directly, or they could come back into the common area. And many of the faculty are using a day in the simulation to substitute for a day in clinical, and having a full day focusing on that prior to testing. So that's really helping bridge that theory to clinical, and then clinical back to theory by having that simulation piece in the middle. We're also using it for orientation to clinical settings. The OB faculty take an entire day prior to going into those settings in the clinical facilities to orient students to what they do in a newborn nursery, what they'll do in labor and delivery, what they'll do in postpartum. And so students, when they go to those clinical settings, can hit the floor running. We're also using it for case studies to bring into our seminars.
What types of clinical scenarios are you running?
Everything from the healthy patient assessment to a complex simulation in our final course where students care for multiple patients that are all running at once and have to prioritize what to do first, what they can delegate, and kind of everything in between.
Our simulation labs are divided into 2 areas of 4 bays each. We have 15 simulated patient mannequins. Those conditions are as broadly varied as pediatric emergencies, childbirth, adult patients with cardiac, endocrine, neurological, and med-surg focus. We also have the ability to do audiovisual recording in all of the simulation spaces. That capability is driven by ceiling-mounted cameras and microphones and recorded through our Beeline audiovisual capture system, which allows for the students to observe their performance after they have completed their simulation. All the head walls that we have simulated oxygen, so it's actually compressed medical air, and also functional suction capabilities. The functional suction capabilities are probably one of the most valuable because it allows the students to actually train on the skill of, for example, suctioning out a tracheostomy. And then the medical air and simulated oxygen are great when they're applying oxygen therapy to their patients. It's fantastic to have these control rooms that are appropriately divided, where we have enough space for each simulation room. It's fantastic to have the audiovisual equipment, which is purpose-built and everything is in place.
Cooperative learning as an educational method has been around a long time, so that skill training, whether it is nursing skills, could be vital signs, could be placement of urine catheter or nasogastric tube. In the cooperative skills lab, with the way it's set up, you can actually teach at a ratio about 2 to 32. And along the way, you can do it in a way that documents performance in that particular skill. So if they can see what they've not mastered, they can continue to practice until they master it. And the cooperation is they learn from each other's mistakes, and they help teach each other.
One of the best things is that you can see the students in the labs. That gives you a great feeling when you walk through the halls and you see everyone engaged.